Okay, we are live now. Just somebody just check if it's fine.
Hello.
Huh. Okay, so should I start?
Yes.
So, good afternoon, everyone. Myself, Varada. I am the Diva representative. This is Queen aren't meant to be ruled by world, but to be ruled in the world. So, I welcome you all to talk on menstrual hygiene on behalf of our club. Now, I'd like to introduce Free Pads for India, which is an initiative, and the objective is to distribute free pads products and educate in order to end the stigma around periods and now I like to say a thing that you all know that for very long time women have been asked to hide the fact that they are on their periods, the pads in the pocket, the strands, the pens as they are born as women, and also for going through a biological process that actually is a blessing to our humanity actually, and we are responsible for its augmentation. So let's break this stereotype. And now I'd like to request Ashutosh to take over. Thank you.
Hello. Hi, everyone. Thank you so much all for joining us today. It's been an absolute pleasure, with the collaboration of Diva Club to here today. We are finally come together, and it is amazing to see, such a bond, where people are coming together and, helping us, break the stereotype and, get away from the stigma. And I would just like to introduce myself. I am Ashutosh Gupta, one of the founders of Free Pads for India. So let me just tell you a bit about who Free Pads for India is. So Free Pads for India is an organization that we've started up to basically end period stigma and end period poverty. Now, I'll just explain a short, brief overview about how we plan to do this. By how we plan to end period stigma is basically by teaching, by educating the future generation about about periods, the problems associated with periods. How to openly discuss periods and to get away from the fact that periods is something that people should not ever discuss in the open. It is about time that we break away from that stigma and the mentality that all of us have been bought. And the only way that is possible is by the future generation that we have, by you guys, basically, to end this thing right here. It is very important that women have been suffering for so long, and they've always been quiet when it comes to this. So it is extremely important that people come together and all the genders are empathetic towards each other. This also brings us to the next point where we bring in expert speakers from the industry. Who one of them who's going to be who's joined us today, and she will be educating you guys furthermore on this. Another major concept that another major issue that we focus towards is ending period poverty. How we do that is that we adopt people who are below the poverty line. below the period poverty line. And what I mean by adopt is that how it is basically how we differ as an organization with any other organization that is working towards periods. So you would have often come across multiple organizations that help people, or they provide pads to people so that they can go through their monthly cycle. But what we do differently is that we adopt these people. We ensure that these people have their period products right from the time till the time that they are over the period poverty line, and they are able to put their needs, like their menstrual needs, over anything else. So our job is basically to adopt these people, and to make sure that they have all the necessities available at their disposal. And to ensure that we reach a wide range of audience, we collaborate with a lot of other NGOs to make sure that we reach as many people as possible. So with that being said, I would like to bring on our expert speaker for today, and who's been extremely generous and extremely humble to join us, give us a time to present, to teach you guys, and to educate you further on this. We have Dr. Richa Bansal with us today, who is a consultant Gynec Oncosurgeon and a robotic surgeon at Apollo and Tata Memorial Hospital. Tata Memorial Hospital being one of the most prestigious hospitals when it comes to cancer patients, and it is extremely generous for Dr. Richa to give us a time and educate all of us here today. So without any further delays, I would like to hand it over to Dr. Richa Bansal. Doctor.
Thank you, Ashutosh, for having me here. And it is my pleasure to be interacting with all of you all today. I must appreciate your efforts and your thought process in working in this field. I think it's very much needed. And nobody can understand the importance of menstrual hygiene and getting out of this social taboo more than me, because I deal with patients, women who are having this gynec problems day in and day out. And let me tell you that this even discussing one's menstrual problem or this is a huge social taboo, not just in rural areas, uneducated families and communities, but even in most advanced, most educated families. I mean, it's just not possible, and women just don't feel comfortable discussing their period problems with others in the family members, so whether it be husband or children or parents. I mean, it's a huge problem, and not just a social problem, but it does lead to a lot of health conditions and health problems as well. And so today, in the beginning, I'll be talking about a few points on menstrual hygiene. And then I would also like to take this opportunity to discuss the viewers about the gynec cancers. So we may feel that cancer is something which is really rare, and and why to talk about it, and why should I know about it? But gynec cancers, or female genital cancers, are really common, and they're increasing. The incidence is increasing, and just not that the incidence is increasing, but we are seeing that more and more of these cancers are now being diagnosed at younger and younger age. And so I think sensitizing our viewers on this is also very important, and I'll be showing you some slides on those. So I would like to encourage the viewers to ask whatever questions, whatever smallest doubts you all have, so which will probably help me in discussing the topics which you all want. So menstrual hygiene, yes, it. I think this phenomenon of menstruation and understanding menstruation should not begin at the time when a girl starts getting her periods, but I think this education should happen much before she reaches the age of menstruation. it should not. It should be perceived as a positive change in the body. The girl should not feel that it is something drastic or something which is unwanted that is happening to her. The importance and the fact that it is normal, physiological, should the girls should be better prepared. I think even in most educated families, we are lacking here that it just comes. The young girls just have to deal with it suddenly without any background knowledge, without they being aware of it, educated about it. And I think that is the first area that we should work upon, increasing the awareness about this menstruation. Then comes the hygiene part. Yes, hygiene part is very important. Availability of clean hygienic pads is a basic necessity, should be a basic necessity for all the girls and women, and I think they should be provided with that. So, good menstrual hygiene and good habits regarding this will go a long way in preventing many kind of genital tract infections. And these genital tract infections, they can be very trivial, but in some cases they can be quite dangerous also. The long-term sequelae or the long-term consequences of the repeated genital tract infections, which commonly happen where there is poor menstrual hygiene, can be significant. The long-term consequences of these can be significant, and they can range from infertility, couple not able to conceive or have children when they want in future, because of the chronic damage to the important genital structures and their function because of long-standing infections. Infertility is a very significant problem, and majority of the cases, majority of the couples, the background reason for infertility in many of the couples is this chronic infections. Chronic means long-standing, because of poor menstrual hygiene. Then other problems the other consequence of it can be as serious as cancer. So, like I will speak about it, the cervical cancer, it is the most common cancer in the women in our country, and it is it is also linked to a common genital tract infection, and all of these can be avoided with a good menstrual hygiene habits. So, what is menstrual hygiene? Menstrual hygiene is basically using clean pads, avoiding and these pads should be changed frequently, avoiding dirty clothes. Generally, in not just in rural areas, but also I'll keep saying this because this is actually true. Not just in uneducated or underprivileged societies, but also in well-educated, well-off families. Menstruation is perceived as something dirty. The dirtiest of clothes and old clothes are reserved to be used for the women for their menstruation. I think that should be done away with. And in that sense, I really appreciate the efforts of Free Pads for India. And I really wish them all the best for their venture. So yes, so first thing in menstrual hygiene is using clean menstrual products, pads. One important thing which is a recent development in this regard is availability of many kinds of menstrual cups. These are silicone cups readily available in the medical shops, also online, Amazon, first Flipkart, everywhere. And actually these cups are very soft. They can be molded, and a lady can insert it into the vagina at the start of her menstruation. uh, Different cup sizes are available depending on her age and whether or not she has had children. So girls who have not had children, they will normally require a smaller cup size. Women who have had children will require a larger size cup. So what happens is that this cup easily fits in the vagina. It's a small, it's a moldable cup, so it can be folded and inserted in the vagina and easily, snugly fits there. It collects on the menstrual blood, and depending upon the severity of the flow, of the severity of the bleeding, this cup can be washed every 6 to 8 hours. And it is just a matter of getting used to using these cups. And many of my friends and my patients and my colleagues to whom I've advised this, they found it very useful, very convenient to use. See, because the other problem is disposal of the sanitary pads. Like I said, this menstruation is perceived as something which is unreligious, and girls or women are not allowed to sit everywhere in the house. They're not allowed to go in the kitchen. They're not allowed to go in the near the temple of the house. So basically, the whole thinking around this menstruation is so weird that even disposal of your sanitary napkins becomes a problem. To and also other factor is that none of these pads, sanitary napkins, are biodegradable. So they add to the plastic waste. So for both these, to contract both these points, inconvenience, many girls find it very useful. A lot of YouTube videos are available on this menstrual cup. A lot of information is available on Google. So I would really urge all the viewers to try this at least once. Not at all expensive. I think it comes at the cost of 500 to 600 rupees, and I mean, it can be easily used for years. One cup can easily be used for years. So I think in that sense also, it is quite cost effective also. So and these cups are absolutely safe to be kept in the vagina for long. And so yes, this I would like to highlight upon this menstrual cup. And you all can definitely go and watch YouTube videos, Google about this, and see if it is convenient for you. So one thing is menstrual cup. And other thing that I want to highlight is in menstrual hygiene, uh, the education. Of course, education is very important. Like I said, it should not happen at the time when the girl starts menstruating, but it should happen before itself, so that the girl can anticipate it and she feels comfortable when she actually experiences it. So I would like to answer more questions if you all have any doubts regarding this. For now,
Uh,
let me just start. I have a small presentation to show you all regarding the gynec cancers and how we should be aware of these. Just a minute, sorry, I have to open it. I'm trying to share my screen. I'm not able to do it. Yes, here. Can you all see this presentation?
Yes, ma'am.
Yes.
Okay. So, both these topics are linked together. The menstrual hygiene, it's a general topic. We can go on and on about it being a social taboo and the hygiene part. But I thought after giving a small introduction on that, I will move on to this, and then we can take the questions. So, I deal with gynec cancers, female organ cancers, and I think the education about this should start early on in life. And I think it will go a long way in our audience being aware of these, and I think it's really important for them. So, moment I say the word cancer, many of you all will be wondering that what is cancer, what causes cancer, and why is that somebody gets cancer, many others will not get cancer, and how is it diagnosed, and can it be prevented, and so on. So, let me tell you, even at this point, as we are talking, a lot of our body cells are constantly dividing, but the division of the normal cells or the growth of the normal cells is under control of our body mechanisms, and it's a very controlled phenomenon. The growth doesn't go haywire. So how cancer develops? It develops when this growth becomes uncontrolled, and it no longer remains under the control of body mechanisms. So the characteristic of cancer, everybody must be knowing, is it originates in one tissue, one organ. Like you all must have heard of breast cancer, intestine cancer, oral cancer. So they originate in one tissue, but they have a tendency to spread to other tissues as well. So this is why cancer is so dangerous. And why are we discussing this cancer? The reason is, over the last decade, cancer in India is on rise. Every year we feel that the cancer incidence is rising. It's not just rising. The even more scarier part is that it is rising even in younger population. Traditionally, we all have read that many of these cancers occur in older women beyond 50s, beyond 60s. But in our clinical practice, many of us are seeing that, same cancers are also happening in women in their 30s, 40s, and so on. So that is why I feel we should be aware of these from early on, and so that whatever precautions can be taken for the prevention, we can take. So, many of us will feel that whenever we say a word cancer, that, okay, it may be affecting others, but definitely it will never affect me. I mean, I hope that is true, but the fact is that, as I said, the incidence is really rising, and, nobody is actually immune to this cancer. So traditionally in women, statistics show that breast cancer is the most common cancer affecting women. Cancer of the cervix. Cervix is the mouth of the uterus, mouth of the womb. So that is the second most common, but actually in many areas, cervical cancer is the most common cancer affecting our women. And this cervical cancer is the one that is directly related to menstrual hygiene and genital infections in the genital organs. So as I will again tell you all that this is the one which is directly related to menstrual hygiene. So when we talk about breast cancer incidence in India, it may be lower as compared to the developed world, But the problem in our country is, like we have already discussing menstrual problems, discussing this so-called female problems, any issue in the breast, any issue in the gynec organs, discussing these problems is a big taboo. And women, they have a tendency to keep suffering, and without disclosing or without talking about these problems to anybody in the family. So the problem in India is that though the incidence as compared to the more developed countries is low, but we do see a lot of advanced cases which have already spread beyond the breast. And this is what is worrying. And this is why we need to increase the awareness. We need to take these lectures, these talks for you all, so that you all know what it is. You all know the common symptoms of common cancers, so that anybody in the family or anybody in your close association, if somebody is suffering from one of these symptoms, you all can make them aware and caution them against the possibility of these things, so that timely medical advice can be taken. And this holds true for all the cancers for that matter. So as compared to the more developed countries, any cancer of any part of the body in India, especially women problems, especially women cancers, they're diagnosed at a later stage because women are hesitant in discussing their problems, and they actually don't get that friendly and conducive environment at home where they can freely discuss about these problems. I think this is what we need to work upon. And so what are the common breast cancer symptoms? So common breast cancer symptoms are any feeling of breast lump or hardness in the lump in the breast, any skin changes, any change in the appearance of the nipple. Nipple may sometimes get retracted inside, any kind of nipple discharge, any lump in the armpit or in the axilla. So any change in the appearance or in the feel of the breast as compared to the opposite side should be concerning and should prompt the woman to consult a doctor to rule out any serious problem. So what are the risk factors of developing breast cancer? You all will ask me, okay, we know the symptoms, but how do we know who is at higher risk of developing breast cancer? Foremost is age. As the age of the woman increases, the risk of breast cancer increases. Though, like I said, though these are the facts that breast cancer is more common in older women, but we are seeing a lot of young women coming up with these cancers in our practice. Again, another factor which is putting the women at risk of breast cancer, especially younger women, women in their 30s and 40s, is delaying childbirth. So with our career choices and everything, we are more likely to delay the first childbirth. We are more likely to have only one kid rather than having 2 or 3 kids. So all these things are increasing our risk of developing breast cancer. Age less than 30 years at the time of first childbirth is protective. Also, number of pregnancies, more the number of pregnancies, more the number of children you have, more protective it is. Also, breastfeeding is protective. Dietary factors, very important for all of you all. High fat intake, higher intake of carbohydrates, especially complex carbohydrates, maida, and canned food, low fiber diet. Obesity is a huge risk factor for breast cancer. Exercise, any kind of exercise, eating fresh fruits and vegetables, limiting alcohol intake are protective against breast cancer. So how can we prevent breast cancer? With some simple lifestyle modifications, like maintaining a healthy weight, inculcating good eating habits, that is having lots of fruits and vegetables, staying physically active, and avoiding smoking and alcohol. So one more thing that I would like to tell you all is one very important thing by which you can prevent breast cancer or at least diagnose breast cancer early is by doing self breast examination. Any lady who is crossing 30 years of age is recommended to do this breast self examination just once a month, hardly takes 5 minutes, but she should do it. All of us should develop this habit, get into this habit of doing self breast examination after we have crossed 30 years of age, so that any problem which may be developing in the breast can be picked up really early before it has caused any much harm to our body. So how is it done? Again, many YouTube videos are there on how to do it. You just have to tell somebody. You can tell your mother, your bhabhi, elder sister. All women in the family who are beyond 30 years of age should be doing this. Lot of YouTube videos by doctors and by general people on how to do this breast self-examination, done with the flat of the hand and palpating both the breasts in all the quadrants, all the areas, including the armpit. Now, so here I am discussing the common gynec cancers or common female cancers of which you all should be aware of. And I really hope that this awareness stays with you all lifelong, so that God forbid any problem develops in any of the family members. You all know what they are dealing with, and you all can guide them accordingly. So cancer of the cervix is again a very common problem in our country. Cervix, as you all can see in this picture, is the mouth of the uterus or mouth of the womb, as we commonly call it. And this cancer of the cervix, if we see statistics, it is the second most common cancer in women. And actually, in many areas, it is the most important cancer in women. So just to tell you all few statistics to help you all understand how major this problem of cancer, cervical cancer, is in our country. It is the second most common female cancer. Again, it is the second most common female cancer in women aged 15 to 44 years of age. You all will realize that this age is the most productive years of a woman. She has a young family. Her contributions to the family, to her profession are immense. And, same kind of cancer developing in a 70-year-old, you don't feel much, you don't feel bad, but same cancer developing in a 35 to 40-year-old, there are a lot of other social implications for it. So cervical cancer is the one, affecting much younger women. India accounts for almost 25% of all cervical cancer cases and deaths worldwide. So this is something which is serious, and that is why all these efforts to make you all aware of these common conditions. Hello. मैं आपको आधे घंटे में कॉल करूंगी. I'm busy in a meeting. Sorry. So, such are the alarming figures that we see almost 70,000 deaths from cervical cancer annually. Approximately 185 women die of only cervical cancer every day in our country. 8 women die every hour. And even as we speak, a woman dies every 8 minutes only because of cervical cancer. So you all can see the seriousness of the situation and the importance of understanding all these things. There was a point, you all must have heard that pregnancy and going through pregnancy used to be considered as a rebirth of a woman. Why? Because the complications during pregnancy, the risk of death of a woman during pregnancy was very high in previous days. So now you all can imagine that death due to cervical cancer has even surpassed deaths due to pregnancy. And such serious is the problem of cervical cancer in our country. It is like a Airbus 320 full of women crashing every day in India. Imagine if this was to happen in somewhere in developed country, in US or UK, it would become an international news for days or weeks. But here in India, this is happening every day, and none of us is even aware of it.
Ma'am, sorry. Just 1 second. I am not able to see the screen. Could you maybe just try checking if you can put the PPT into a full, present the screen, or maybe disable sharing screen and try it once again.
Okay, you are not able to see the PPT.
We're able to just see the first slide of the PPT. So if you could just try disabling sharing and try connecting it again, maybe that will help.
I did stop sharing.
Yeah, just try connecting it once again.
Okay, but it's not happening actually.
Ma'am,
just a minute. Yes.
You just there's an option there to share your screen the way you did before.
Yeah, it's not showing. Probably.
Just go on to StreamYard, press the share button.
Can you all see now?
Yes, ma'am. Yes, ma'am.
So I'm presentation mode.
Is it seen now?
Yeah, ma'am, but it is still not in the presentation mode. Yes, the slides are changing now.
Yes. Yeah, I think this is fine. Thank you.
This is fine? Okay.
Yes.
Yeah, if you can just put it into the presentation mode.
I did actually.
Okay. Okay, no problem. Let's go ahead with this. That's fine.
I think it's not happening there, but okay, this is visible, ma'am.
On my screen, it is coming as a full screen, presentation mode.
Oh, ma'am, actually, we are not able.
Okay, no problem, ma'am. I think it's clearly visible anyhow. So yeah, let's go ahead. I think.
What is the cause for cervical cancer? Cervical cancer again happens because of kind of a genital tract infection by a virus which is called human papilloma virus. And actually this genital tract infection, HPV infection, is very common. So whenever a couple start their sexual life, almost 90 to 100% of the couples will develop this HPV infection, human papillomavirus infection, in the genital areas in the next 6 months to 1 year. But at the same time, due to our body's immunity, 90% of these couples will clear this HPV infection on their own in, again, next 6 months of time. So though this HPV infection is very common, it gets easily treated as well. It is self-limiting with the help of our body's immunity. But in few women, probably because of weak body immunity, or other reason is if there are multiple other genital tract infections because of poor menstrual hygiene, this HPV virus infection will remain persistent in the genital tract. This infection will not get cleared from the genital area, and this, in the long run, over the next 2 to 3 years, will give rise to cervical cancer. So again, this is linked to poor menstrual hygiene in our country, and actually the distribution of cervical cancer cases are seen in areas where the population is so socially backward, or not well to do, and less educated people, lower socioeconomic class. But again, like I said, these are just the population based observations. At the individual level, anybody could be at risk of cervical cancer. So so the main point that I want to share with you all is that this cervical cancer main reason is a form of genital tract infection by human papilloma virus, And we do have a lot of measures that we can take, that you all can take, to prevent this cervical cancer from developing. First, most important is vaccination. So we do have, like I told you all, cervical cancer occurs because of this human papillomavirus infection. It is like any other viral infection, like influenza, like hepatitis. So we do have, the way we have vaccines available against hepatitis, and hepatitis vaccines are now a part of national immunization program, and all kids invariably receive this vaccine. We also have vaccines against HPV, human papillomavirus, and the recommended age is between 10 to 13 years of age. Girls, please listen to this very carefully. The ideal age of receiving this vaccine is 10 to 13 years, but any girl who is unmarried up to 25 years of age can still receive this vaccine. This HPV vaccine comes in two brands, Cervarix and Gardasil, and these vaccines are easily available in any of the pharmacies near you. If you consult any gynec or a pediatrician for this vaccine, they will definitely give you more information on this HPV vaccine. And it's an absolutely safe vaccine with proven efficacy against cervical cancer. So this vaccination, we are actually trying our best to promote this vaccine. All the developed countries have included this HPV vaccine as a part of their national immunization program. How our kids receive polio, diphtheria, hepatitis vaccine, there's a fixed schedule for it. Similarly, this HPV vaccines are part of their immunization programs, and they receive it. Every child, every girl child receives this vaccine. So in India, we have not been able to do it because of many other issues, logistic issues, monetary issues. And I think the foremost important is lack of awareness. The awareness amongst general population about the problem of cervical cancer and the availability of this effective vaccine that we have is very poor. And that is why, at our level, what we are doing is to increase the awareness about the cervical cancer and the vaccine which we have. So this is one important point that I wanted to highlight today, that we do have vaccine against this HPV virus, which is the main cause of cervical cancer. And all of you all can inquire with your gynecs, or you all can get in touch with me regarding this vaccine. Other measure or other tool that we have in our armamentarium against this cervical cancer is screening. Screening is with the help of a very simple pap smear test. It involves a gynec examination, hardly takes 5 minutes, not at all painful. Any gynec will be able to do it. When do we start this screening? From 35 years of age to 65 years of age. So any woman who is between 35 to 65 years of age should undergo screening with this simple pap smear test. And this pap smear test needs to be done every 3 years. It's not that every 6 months or every year you have to do it. Once a woman's pap smear test is normal, she can take the next test after 3 years. She's safe from cervical cancer in the next 3 years, and next test needs to be done only after 3 years. Not at all expensive and very effective in preventing cancer. How does it prevent cancer? Because this test detects slight abnormalities in the cervical cells. So simple gynec examination say we can collect few cells and we can study it under the microscope. And with that, the test result shows if there are any abnormal cells developing much before the cancer develops. If there are any abnormal cells, there are multiple ways to treat it so that the condition does not progress to cancer. So this is how we can prevent cervical cancer. So like I've said, both vaccination programs and cervical cancer screening programs are very well developed in the Western countries, and hence the cervical cancer is not a major problem in the Western countries. Same thing we can do for our country as well, by improving this availability of the vaccine, availability of the tests, increasing the awareness. We can eventually eliminate the problem of cervical cancer from our country, which is actually such a big public health problem. So, like I said, cervical cancer prevention starts in the adolescence. The ideal age is less than 15 years, 10 to 13 years or 10 to 15 years. These are the two vaccines which are readily available in all the major pharmacies, and any general gynec will be able to help you out with this. Just to in short show you all the impact of vaccination and screening. So the recommendation is that you vaccinate girls before their marriage, and when they become 35 years and above, they undergo screening. And the dual modality will give us a long-term protection from cervical cancer developing. So this bar here shows that the risk of a woman's developing cervical cancer and risk of a woman dying from cervical cancer is reduced by 44% by just vaccinating. And if we combine vaccination along with screening, then we can significantly decrease the risk of getting cervical cancer and dying from it. Unfortunately, in our country, vaccination uptake is less than 1%. Less than 1% of our population is aware of this possibility of vaccination, and less than 1% take the facility, and less than 2% or less than 3% women are aware about the screening and about the availability of these tests. So basically, it is lack of awareness that this problem of cervical cancer can be prevented by doing simple measures. So that was about the preventing. Now, what are the common symptoms of cervical cancer? If any woman is experiencing these symptoms, she can be guided that probably she is at increased risk of having the cervical cancer and she should go for a checkup soon. So what are the symptoms? Any kind of pain in the lower abdomen, any unusual vaginal discharge or lower back pain, pain during sexual intercourse, any kind of abnormal vaginal bleeding, either during periods or after sexual intercourse, or heavy menstrual periods could be suggestive of cervical cancer. So another I'll not take much time from here on. Another common gynec cancer is uterine cancer. Cancer of the womb, again a common scenario. So what are the symptoms? Any abnormal vaginal bleeding. This is a cancer that happens after menopause in older women, but actually no age is immune to any cancer, can develop in younger women also. Bleeding in between periods and pain in the lower abdomen. So you all girls must have heard about this condition called PCOS, polycystic ovarian disease, a very common condition affecting young girls, in the teenage girls and women in 20s. So this PCOS is commonly associated with obesity and irregular periods. All of these can be associated with this uterine cancer. Again, so you all just have to be aware of the symptoms, that any kind of abnormal menstrual bleeding is abnormal, and one should get herself checked once by a gynecologist to rule out any kind of serious problem. Other gynec cancer which is common is ovarian cancer. So ovaries, we have two ovaries, one on either side of the uterus, and this ovary can become cancerous, can become malignant. And what are the common symptoms for this ovarian cancer? Any kind of abdominal bloating or swelling, quickly feeling full when eating. So even after eating small amount of food, the woman starts feeling quickly very full, as if she has eaten a lot of food. Constant bloating, constant heaviness in the abdomen, There may be weight loss, constant discomfort in the lower abdominal area or in the stomach area, changes in bowel habits such as constipation, loose motions, and frequent tendency to urinate. So, all of these symptoms could be abnormal, and one should not ignore. Normally all these are symptoms which are normally attributed to some lifestyle changes. Okay, I ate something outside, that is why I'm having this indigestion and fullness and everything. So we have a tendency to ignore these symptoms. Probably, okay, I've eaten this, I've eaten that, or not eaten, and that is why these problems, acidity problem. So, but if these symptoms are remaining persistent for a few days, then one should not ignore these symptoms. So this is the general medical advice that I would want to give you all, that prevent weight gain, stick to a healthy weight by having balanced diet, rich in fruits and vegetables, and also by doing regular physical activity. Obesity is not at all good for our health, and it can, today you all have seen that it can be associated with different kind of cancers of the body. Limit alcohol, tobacco, and get regular checkups and cancer screening tests. If you all have any doubts, you all can ask me in future also. You all can get in touch if there are any queries regarding this. So I hope this talk was relevant. It was slightly this thing, but I think it is still relevant.
Ma'am, thank you so much for sharing us such great insights, and it was really helpful. So, ma'am, we actually have some questions from the audience. So, can we ask them?
Yes, sure.
So one of the question is most of the families face it that they don't talk about menstrual hygiene, and it is not they are not comfortable talking around men of the family. So how can we develop that menstruation is very normal and you can talk about it anytime, and at the home, at least home should be comfortable, right? So
Right.
that is one question.
So I think education is very important, not just for girls but also for boys. Even this menstruation should not be thought about as something which is unique and which only girls have to experience. It should be taken as, or it should be, the thought process should be that it's very physiological and it's very normal for the girls to menstruate. I think an important role will be, of course, played by the mother and the parents, and also by school. So this sex education about menstruation is very important at the school level, as well as friendly home environment, I think, is most important. uh, you know, how a boy perceives menstruation. I mean, I think majority of the boys get to know about it after they, enter college, or even at a later stage of their life. And that is not the right time, because, if something has been hidden from them for so long, if their sister is facing this, I would not say problem, but if the sister is facing this situation, and if they were not told about it, that automatically this thing, they get this feeling that, okay, probably it's not normal for me to know about it, it's not normal, or it's not natural, and this is something which I should not be aware of it, and this is something which I should not be talking about in the family. So I think having a friendly home environment, and talking about it, I think will go a long way. And similarly, how they've been brought up, and they will also help. Because we see that many of the women are not just comfortable speaking about these problems to other members, but to their husbands also. So they will not share these problems with their husbands also, which is something which is really weird. So I think this whole mindset should change. uh, and I think it's not a very big deal. It's just that we have to stop projecting this as a problem and something a girl's problem or something. It should be uh, it should be something which is very physiological.
Yes. So ma'am, regarding this only, so there are lots of myths about menstruation while you're menstruating. As you said, one of them that you cannot go around the temple, or there's something that you cannot touch the pickle and touch the plants, they'll die, and something like that. So, like, how much of them are actually realities and just myths?
I think all of them are just myths. Um, the reality is only this much, that it's physiological, very important aspect of a girl's growing up, very important aspect of her body. It is something which is absolutely normal, and and in fact, it should be treated as an important thing. I mean, she is able to bear child because of this function. So I think that should be in fact respected. So I think
Yes.
it's all myths that girls should not, they cannot go to many places in the house. They should remain confined to their own rooms. And I think it's not just a problem of, like I've said many times, uneducated societies, uneducated people, but even in cities, highly educated people, especially people who consider themselves to be very religious. I think uh,
Yes,
this is a problem. So
yes,
I think it will take some time, but at least we can teach our children, and we can teach to people at your age, so that you all will handle this situation better with your kids, whether it's
Absolutely.
boy or girl. So I think we should start wherever we can, at whatever age that person is, but at least making them, because not just like, many of my old patients, postmenopausal lady who has achieved her menopause, and if she starts experiencing any gynec problem, they are not at all comfortable discussing it with their son or with their husband. Post-menopausal bleeding, that is having bleeding after a woman has achieved her menopause, is very serious. In fact, one of the most common reason for postmenopausal bleeding is cancer of the uterus, cancer of the womb, or cancer of the cervix. And it is actually very alarming. And still many of not many, most of these women ignore these symptoms till the time their overall health goes down, and they start getting other symptoms as well. They start having problems in their urine and passing stools and all those things. And when we ask them, why did you not come before, she will be having these problems for years together, 2 years, 3 years. No, doctor, I was not feeling comfortable. I stay with my son and daughter-in-law. And how to tell them that at this stage also I'm getting periods? This is the very very common situation. And husbands तो बिल्कुल ही नहीं बोल सकते हैं. They cannot share this with their husbands at all. And
Yeah.
they feel very awkward discussing it with their son also, that how at my age I'm getting periods, how can I tell? It is so shameful. So these are the myths, and this is the thought process.
yeah. This
So
should be totally changed.
so all of us, of course, you all are doing a great job. I think this is another thing that you all can take up, in spreading awareness about around this menstruation thing to
Absolutely.
make this a normal thing. And we as doctors, we are also I do a lot of such sessions, and try to tell people that even if you're not comfortable discussing it, we cannot change that overnight, but at least understand that there can be serious health consequences of ignoring these symptoms and not consulting their doctors or not getting the investigations done early. So at least from that point of view, these symptoms should not be ignored.
Yes, ma'am.
Ma'am, if I
That
if I may ask you a question here, just pardon, maybe I am just naive in this. I'm not sure. But how would one, for example, differentiate between normal bleeding or periods like as you mentioned, post-menopause? So is there something like probably some way that they could understand the different kinds of bleeding that there may be?
So, see, a woman always understands her normal pattern of normal menstrual pattern. Normally, there is a fixed pattern. There can be variations which are normal, which are physiological, but they do understand the normal that, okay, normally periods are for 4 to 5 days, the flow is this much. The timing is this. It's a 28-day cycle. Every 28 days, she expects that, okay, now she will get. So we say that any variation from your normal period, and especially which has been persistent. Suppose suddenly for last 3 months the flow has increased. Initially it was 2 days of heavy flow followed by moderate flow for next 2 days, and period used to stop completely. But last 3 months, if you're experiencing heavy flow with a lot of clots, which is actually causing weakness in her uh, for last 3 months, then definitely this is not something which should be ignored. Or if there is spotting after her normal periods, like 4 days normal periods, and then she continues to have spotting for next 1 week. This was not happening before, and now she started happening. Now this has started happening, then definitely she should consult that this is not the normal pattern, normal way of her period, and she should consult. Other thing is postmenopausal women understand that, okay, now I have reached menopause, my periods have stopped for last 6 months or 1 year. Medically, we define menopause as stopping of periods for 1 year. So once a woman is beyond 1 year from her last period, we say that she has achieved her menopause. So any bleeding after that 1 year we consider as abnormal. It is not normal. So woman herself knows that, okay, I had reached menopause, I had stopped my periods at the proper age, now again the periods have come. So they do understand this is something abnormal. Only thing is they don't free feel to communicate it to others, to other family members.
yes, ma'am.
That's
And
definitely
especially
correct.
this tendency amongst women to ignore till they just can't take it. Like, if in a family, I think it's a common tendency of women that if there'll be some problem with the husband, some problem with the kids, they will immediately rush to the doctors. Some
Yeah.
problem with our own self, okay, we will ignore, not talk about it. We will tell some friend who will also ignore. How? Okay, theek hai, I think nothing to worry about it. This inherent tendency, not just regarding menstrual thing, but even other problems, we just tend to ignore, and our own health comes as the least of our priority. I think that mindset should also change.
Yes, ma'am.
That's
And
very true.
once women लोगों ने सोच लिया that, okay, no more of this attitude and we have to change, our health is also important, then automatically everybody around you will also change. If you will not give any importance to your own health, then obviously you will not get any importance. I think this is also very important, that women's health is ignored by herself, by other family members. Only when it's really serious, when everybody understands, okay, now this is really serious that is happening, only then they will rush to the doctor.
Yes, ma'am. That's
Absolutely, ma'am. I think I have seen this even in my families, like, so some of
yeah,
my far-fetched families, I have seen them all, like, everyone is just so quiet, and like I've seen them suffer, but they wouldn't ever say a word against, like, they may just be sick, like, not even related to periods, but they may just be sick, but they would just be like, all right, this is my importance
They
is
will
not as
behave as
important.
if everything is
Yeah,
fine, even if they are running
yeah,
fever, even if they
yes,
are,
ma'am.
dealing with some other problems, headache. So, all of us have seen in our families, and it's from there that we get this. I've seen my mom doing it, so I will also do it. It's like that.
absolutely. And that's what we actually should be breaking, and we should, like, that has to stop.
Yeah, that stereotypes must be stopped.
Yes.
Okay, ma'am. So I think that's all, and we'll move towards the closing of this event. So Ashutosh, you can take over.
So, ma'am, I am honestly really, really thankful for for you to make this time for us, and so it's just been so generous of you that you came here today. You spoke about, and you've provided such immense knowledge for all of us. Like me being a guy, for that matter, I have learned so much that I I had a bit I had a fair amount of idea, but the level of details and the methods that you explained today, all of this, it gives me immense knowledge and immense happiness to really say that, okay, I learned a little more today, and that's absolutely amazing. I mean, maybe it's not good, not for me, but I know if someone else tomorrow would ever go through something, it would be absolutely amazing. Like, I would be able to help them out. Maybe I would just be able to understand their situation better. So
No, I
really, really thank you so much,
totally
ma'am.
agree with you, Ashutosh. One small point that I missed
Yes, ma'am.
is that we need to educate not just women, because that will not solve the purpose. Because बात वहां तक ही रह जाएगी. अभी तक भी women
Yes,
know what the problem is. Even if so, we also educate only the women. It will not help. They will still not be able to tell the husband or the son that okay, this is something serious which is happening to me. So I think educating men is boys is also equally important, and only then we will be able to sort out these issues. Because I think the problem will remain the same if we educate only the women.
absolutely.
They will again ignore, and they will not get a complete solution from it. So this is rightly said by you that I think educating men is equally important, so that they will understand. And once your wife, your mom knows that okay, he understands, they will be more comfortable talking about that problem with you. If they
Absolutely.
believe that no, you don't know anything about it, you will not understand anything of it, then obviously they will not feel comfortable talking about that.
Exactly. And I think it is very important for people to, actually be able to communicate with others. I mean, there has always been this thing that I've generally seen that, women would only speak to women about such things, but it's possible that the other person may also not know nothing about it. And then there are like two people fooling each other and there is no solution. So I am not saying maybe a man would help there, but I think educating just generally to everyone is extremely important. So it is, I think, apart from just sex education, even period education is equally as important for men, to understand the other gender and to be empathetic towards the other genders. And I think as women, you all go through a lot of changes, and there are so many hormonal changes that you all go through. It, I don't think as men we may be going through any, like, even a percentage of that, but the
Of
least that we can do is
course.
understand you all. Yeah,
Yeah, and it would be
But
amazing to
you
have.
will, if men are talking about the women, that okay, mom, today I've learned this, and I know that this is something serious, any abnormal bleeding, this, that. So I think automatically the women of the house will feel more comfortable discussing it. So
absolutely,
Yes, ma'am.
absolutely. So I think that was like an amazing session, and thank you so much for your time, ma'am. I honestly, I don't know how to really thank you for this. Like, it's been so amazing to have you here, and for you to make the time. I know you come after like a long day of work, and I know how difficult it was for you to manage everything, and just for the other people to know, like the doctor just came like from her shift and she directly jumped over here, and that pretty much says the importance of our frontline workers today, and how much effort that you guys put in behind all of this. So thank you so much, ma'am, for coming on call with us today. Thank you.
Yes,
You're
ma'am.
most welcome and thank you for appreciating. I hope it was useful.
It
Yes,
was
ma'am.
absolutely amazing.
Yes, ma'am. Totally. Thank you so much, ma'am.
Thank you, ma'am.
Bye.
Yeah. Thank you, ma'am. Have a nice day. Bye bye.
You
So
too.
uh so just So, for the audience, we have a special surprise for everyone that's been attending us here today. Uh, we have a small present, basically. All of you all have been so kind and made your time for us here today. So we have a small surprise, and we are going to be offering a small gift for 5 lucky winners. And it's a very simple thing that you guys have to do. That is basically, follow us and Diva Club as well. And, if you can just, like any particular post that you like, to share that post on your story and, tag Free Prats for India as well as Diva Club on your story. And you will be eligible to win a special surprise. So, with that being said, I will make it easier for you guys, and you can just scan the QR code here, and you can follow us. Also, I would really appreciate all of you all to just there is a link in the description as well as in the chat box. You can just go click on the link and share your feedback. Tell us how you felt about uh, the session today. What have you learned? And that will help us improve and provide you more content that you guys probably want to hear. So thank you so much all for making the time for us today and getting out of your schedule and learning something new. Thank you.
Most
Yeah,
welcome.
and moving towards the conclusion, now I like to say things that being a doctor itself makes the difference in the lives and your of your patients, and also your kindness, sincere caring. Everything comes up. And so, on behalf of VIT, SWD, and Diva Club, would like to express my heartfelt gratitude to our speaker, Dr. Richa and NGO. Thank you so much, ma'am, and Free Pad for giving us your time and sharing this much important knowledge, and also for a great encouragement. And to all our secretaries and courts who have actively came forward and make this event successful one. So thank you so much all.
So I think we can end the session here.
Yes.
Yeah,
Thank you all. Thank you guys.
Thank you so much.
thank you both,
Thank you so
you,
much.
thank you, ma'am.
ब्रॉडकास्ट एंड कर दूँ ना?
हाँ